Welcome, everyone. I am so thrilled to have you here for today's explainer. Today, we're diving into a topic that affects millions of women, but it's often surrounded by this dense cloud of confusion, frustration, and just plain misinformation. We're talking about polycystic ovarian syndrome, but more importantly, we're focusing on how you can take control of your health through highly actionable everyday lifestyle habits. If you've been feeling overwhelmed by your own body, trust me, you are exactly in the right place. We're going to break down exactly what's happening and how you can reclaim your health step by step.
Okay, let's dive into this by looking at the sheer scale of the condition. In India alone, a staggering 1 out of every 5 women is found to have this disease. That is 20%. If you're dealing with this, I want you to internalize that statistic and realize something absolutely crucial right now. You are not alone, not by a long shot. This is an incredibly common hormonal issue.
Now, before we go any further, let's clear up a massive piece of medical confusion right out of the gate. You might hear your doctor say PCOD, which is polycystic ovarian disease. Or you might read articles talking about PCOS, polycystic ovarian syndrome. Well, they are exactly the same thing. Literally just 2 different names for the exact same underlying medical reality. So, whether you've been diagnosed with PCOD or PCOS, everything we cover today applies directly to you.
Here's our quick roadmap for today. First, the PCOS reality check. Second, symptoms and root causes. Third, diagnosis, listening to your body. Fourth, core lifestyle recovery changes. Fifth, the PCOS diet plan. And finally, number 6, targeted medical treatment options.
All right, Section 1, the PCOS reality check.
So who does this actually affect? Well, PCOS primarily strikes women during their reproductive years. The highest concentration of cases falls right between the ages of 20 and 40. I mean, think about it. This is the time when you're focusing on your career, your relationships, maybe starting a family. To be hit with a complex hormonal issue right in the middle of all that can feel incredibly unfair, right? But knowing this demographic is your first step to understanding that what you're experiencing is a known, well-documented medical reality.
Moving right along to Section 2, symptoms and root causes.
So, have you ever wondered why it has the word syndrome in its name? It's because it presents with multiple, often wildly different symptoms. A major hallmark here is irregular periods. We're talking less than 8 periods a year. But then on the flip side, when those periods do come, they can be unusually heavy because the body is shedding a thickened uterus lining. Other symptoms? Stubborn weight gain, especially around the waist. You might also notice excessive hair growth on your face, chest, or back, while actually losing hair on your scalp. Oily skin and acne are super common too. And finally, because of irregular egg formation, a lot of women have difficulty getting pregnant. It is a lot to deal with, for sure, which is exactly why it requires a comprehensive approach.
Now, what's really fascinating here is the exact chemical breakdown behind these symptoms. The root causes basically boil down to 2 things: hormonal imbalance and genetics. First off, your ovaries normally make both male and female hormones, right? But with PCOS, the levels of testosterone actually increase. Alongside that, your prolactin and luteinizing hormone levels spike, while a helpful protein called sex hormone-binding globulin drops. All of this just throws off normal ovary function. And the second piece of the puzzle, genetics. If your mom or your sister has PCOS, your risk of developing it goes up significantly.
But wait, there's a third, massive root cause we have to talk about: insulin resistance. And this brilliantly illustrates the metabolic unfairness of this syndrome. In a standard system, insulin digests glucose, simple. But in a body with PCOS, step 1 happens. The body produces low-quality insulin. Because it's low quality, we slide right into step 2. Your body is forced to pump out way more insulin just to digest the exact same amount of sugar. Which brings us to step 3. Those insulin levels aggressively spike, and all that excess insulin literally locks in stubborn weight gain. It's just a massive biological domino effect.
All right, Section 3, diagnosis, listening to your body.
If any of these symptoms are sounding a little too familiar, you'll want to consult a doctor. They'll look at your history, your cycle, your weight, your family background, but to officially confirm it, you'll need specific blood tests, usually done on an empty stomach or on the second day of your period. I want you to feel totally empowered when you walk into that clinic, so here's exactly what they're looking for. They'll check your primary hormones, like FSH and LH, plus a lipid profile and a glucose tolerance test to spot that insulin resistance we just talked about. They'll also check your thyroid and prolactin, and if you're dealing with acne or hair fall, they'll test your free testosterone. Finally, they'll do a quick ultrasound to check for small cysts on your ovaries. Finding those polycystic ovaries, that's what officially confirms the diagnosis.
Section 4. Core lifestyle recovery changes.
Now, this is truly the most empowering part of our explainer today. This is where you get to take your power back. I want to draw your attention to an exact quote from our medical source material. We are trying to give you more lifestyle changes so that your medicine intake can be reduced. I absolutely love this because it perfectly sets the theme for recovery. Yes, medication has its place, and we'll get to that, but your daily habits, your daily choices, those are the real heroes here. Lifestyle modification is the absolute foundation of taking control of PCOS.
The fundamental first step in these lifestyle changes is weight loss. Now look, I know we literally just talked about how PCOS makes your body overproduce insulin, which chemically makes losing weight so much harder. I totally get how frustrating that is. But reducing excess weight is absolutely crucial. Why? Because shedding that weight directly improves the quality of your insulin. As that insulin quality goes up, your overall hormone levels finally start to balance out. And as those hormones settle down, natural egg formation can actually begin to happen on its own, which is a total game changer if you're hoping to get pregnant.
So how do we actually tackle this? Well, I want you to burn this specific number into your memory, 30 to 45. The golden medical recommendation to improve your insulin quality is 30 to 45 minutes of exercise for at least 5 days a week. And honestly, the best part, it doesn't have to be some grueling, boring routine. You can do yoga, Zumba, CrossFit, just a brisk walk, whatever you actually enjoy doing. The specific type of exercise matters way less than the consistency. If you just do it regularly, you are literally rewiring how your body processes sugar. Alongside moving your body, we have to look at the other pillars of your day. You need to be getting at least 8 hours of sleep. You've got to eat your meals in a timely, consistent routine. And, maybe the hardest one, you have to actively work to reduce your daily stress. Hormones are incredibly sensitive to sleep deprivation and stress. Think about it. If you're working out constantly, but only sleeping 4 hours a night, your body is just staying in a state of hormonal chaos. You really have to treat rest and stress management as if they're a literal prescription from your doctor. Let's move to Section 5, the PCOS diet plan.
Okay, let's see how this all builds together. Try to visualize your next grocery run. First, on the avoid list, we have the stuff you really need to skip to stop those insulin spikes. That means ditching the sweet drinks, jaggery, honey, and even overly sweet fruits like mango. You also kind of have to break up with white flour. Yeah, sorry, that means holding off on the biscuits, pizzas, and burgers. And try to limit your excess tea and coffee. But on the flip side, there is so much great stuff you can enjoy. Focus heavily on protein-rich foods like chickpeas, beans, eggs, and lean meats. Load up on leafy greens and nuts like walnuts and chia seeds. And when you're cooking, try to swap in rice bran oil. The whole goal here is just to feed your body foods that keep your insulin nice and steady.
And, finally, Section 6, Targeted Medical Treatment Options.
So, the crucial point to remember here is that medicine for PCOS is highly targeted. It's prescribed based on your specific symptoms to act as a supportive bridge while your new lifestyle habits take root. For instance, if your main struggle is menstrual issues, doctors will usually prescribe oral contraceptives. You take them to artificially regulate the cycle, usually for 3 to 6 months, giving your body time to reset. If weight and insulin are the primary battles, you might see prescriptions like metformin to help improve that insulin quality. Dealing with excess hair or acne, anti-testosterone meds like spironolactone are used long-term to clear up the skin. And if you're actively trying to get pregnant, doctors might use medications like clomiphene right at the start of your cycle to jumpstart egg formation. The medicine supports the symptom. Your lifestyle supports the cure.
We've covered a ton today, the science, the symptoms, the diet, the treatments, but I want to leave you with this final, really vital question. Which of these daily lifestyle changes will you take control of today? Is it going to be finally prioritizing those 8 hours of sleep? Will it be swapping out the white flour for some protein-rich chickpeas, or maybe scheduling just 30 minutes of Zumba for tomorrow morning? Look, PCOS is tough, no doubt about it, but it is completely manageable when you understand how your body actually works and commit to the daily habits that support it. Thank you so much for joining me for this explainer, and I'll catch you in the next one.